COVID-19 pandemic has created immeasurable challenges across the country. Unfortunately, fraudsters have found ways to take advantage of those challenges for financial gain. At the Department of Health and Human Services, Office of Inspector General, investigators are hard at work ensuring that you, your personal information, and taxpayer dollars remain protected from COVID-19 related schemes. Just as the pandemic is constantly evolving, so too is healthcare fraud. Fraudsters have leveraged anxieties, challenges, and societal needs produced by COVID-19 to find new ways to target beneficiaries. As Assistant Special Agent in Charge Steve Mahmood explained,
they're using COVID now as a kind of a gateway to do traditional fraud.
Fraudsters are selling fake vaccination cards, unauthorized testing kits, collecting personal and medical information from testing sites to bill for unnecessary services, and pretending to be contact tracers or other public health officials to obtain your personal and financial information. That information can then be used to commit medical identity theft and fraudulently bill federal healthcare programs. Today, HHS-OIG's Office of Investigations remains hard at work combating COVID-19 healthcare fraud. Our hotline receives thousands of tips and complaints from the public. The information about fraud, waste, and abuse we receive via our hotline can assist our agents and analysts. The Office of Investigations also works with the Department of Justice and other law enforcement partners in fraud-fighting efforts and collaborates with other HHS-OIG components to develop appropriate enforcement actions and recommendations. The dedication of OIG investigators has led to the successful prosecution of egregious fraud schemes that undermine pandemic response efforts. In 2021, HHS-OIG participated in sweeping, coordinated law enforcement action to combat COVID-19 related healthcare fraud. This 2021 National COVID-19 Healthcare Fraud Takedown led to the charge of 14 defendants across 7 U.S. federal districts, worth roughly $143 million in false billings. Over 50 medical providers received administrative actions for their involvement in the schemes, and defendants included physicians, marketers, and medical business owners. In April of 2022, we built on those successes and announced a national enforcement action which brought charges against new defendants, including manufacturers of fraudulent COVID-19 vaccination record cards. We are proud to work alongside key law enforcement partners and investigate and prosecute these schemes in real time as they evolve. As COVID-19 fraud schemes continue to proliferate and evolve, investigators have a few tips that can help you protect yourself and your personal, financial, and medical information. 1. If a testing site is free but asks for your financial and medical information in order to receive a test, that's a red flag. Be vigilant when getting tested and make sure you use a legitimate provider. Visit your local, state, or federal government website for a list of approved testing sites. 2. Be suspicious of any calls, visitors, or solicitations offered COVID-19 tests, vaccine cards, or other supplies.
Any reputable provider, especially Medicare, they're not going to contact them via telemarketing.
3. Do not click on suspicious links in emails and text messages.
Be cautious of people showing up at your door for you to participate in a COVID vaccine survey for gifts and things like that. And most importantly, don't share photos of your COVID vaccine card on social media. Remember, that card has your personal identification information on it, and that's all a fraudster needs to continue to commit fraud against our programs.
If you suspect that you've experienced COVID-19 healthcare fraud, our investigators encourage you to report it to the HHS-OIG hotline by calling 1-800-447-8477 or visiting tips.hhs.gov. At HHS-OIG, we're committed to rooting out fraud, waste, and abuse of federal healthcare programs and protecting the health and safety of beneficiaries. Thanks to the hard work of the Office of Investigations, you and your loved ones can stay protected from COVID-19 healthcare fraud.